A very good morning to one and all. I'll introduce Dr. Padmini Murthy in a short description. She is Professor and Global Health Director at New York Medical School of Health Sciences and Practice. She is a trained obstetrician and gynecologist. She has been practicing for past 28 years. She serves as a medical Women's International Association NGO representative at United Nations. She is the author and editor of Women's Global Health and Human Rights textbook and has many more to her credit. Her field of interest are women's health and human rights. She works to promote safe motherhood and other health initiatives focused on women in India, Malawi, and Grenada. She is a recipient of many national and international awards, and currently she is chair-elect of International Health Section, American Public Health Association. She'll be speaking on women physician advocates of health and human rights. Ma'am, you may start, please.
Thank you so much, Madam Chair. Thank you so much, everybody, for having me. And I would just like to thank Dr. Mandakini Meg, because she's the one who twisted my arm to come here. And I would also like to thank the AMOGS organizing committee, Dr. Pranjal, Dr. Rashmi, Dr. Pushpa. I mean, thank you so much for having me. So it's really interesting because I am not touching on anything clinical. We've had a great 2 days, 1.5 days talking about clinical issues. But the reason when actually Manda asked me to talk about it, I said, let me talk about women physicians, how they've been advocates of health and human rights. Because even though we don't really think we are promoting human rights, and I think we physicians are, especially women physicians all over the world. And I think it's really great for me. Thank you for this opportunity. It's really an honor to be speaking in Vidarbha region, which has been at the forefront of promoting women's issues and human rights. I think you had 5 hospitals over the past century which were totally focused to looking at women's health. So I just wanted to start off by thanking, by applauding all of you for really carrying the torch. So, and before I get started, I just wanted to say that I was thinking as everybody was talking, is when we all talk about people who influenced us, I think it's our mothers. Yes, my mother who passed away last year was a great role model, but I would also like to give a shout out to 2 people. One is Dr. Usha Saraya and also Dr. Sati Keswani, because these 2 women are amazing. And I would like to add Manda to the list, but I don't want her to say, "Arey kya ye itna bol rahi hai mere bare mein." So, but I just wanted to add like these 2 people too, because I think they're amazing mentors. So, as you can see, my objectives here are, I'll be discussing the link between health and human rights, and I will briefly highlight the role of women physicians are advocates and defenders of health and human rights, and also what are the efforts being made. So as we all know, the World Health Constitution does stress the highest attainable standard of health. But unfortunately, now we are in 2020. I mean, this is a momentous year because it is the 75th anniversary of the United Nations. It is also the 25th anniversary of the Beijing Platform of Action. So this is really crucial. But I would like to just add that the present president of AMOGS, Dr. Nandita, and again, I won't say past president, the torch bearer, Dr. Rohini, I think it's really important, without you really knowing, you stressed on the Beijing Platform of Action, which really talks about women's issues. But here my talk is going to be just not looking at it from the health point, but we are looking at the social determinants of health, which really influence what we are, how we are. It also denotes how we practice and how we serve our clients. That is, we are all stakeholders. So one of the things recently which the UN has been doing, and I've had the privilege of working on it from the NGO aspect, is we are promoting gender harmony. It's not saying, oh, women, yes, we need our turn, and yelling and screaming. I always tell my medical students is that, advocacy is important, but we need to be practical. It's not like just saying, holding up a banner or a placard, but we need to say, how do we go from A to B? And as an academician, I mean, it was so nice that Dr. Pushpa, you were honored by your students. It means a lot. And I think what we do is we really need to see how can we influence their fertile minds, they're not infertile, is to move forward to take, you know, things. So one of the things which we are really looking into is gender harmony with the human rights approach. So it's not that the male is superior or the female is inferior. We just want to work with you to make sure we are all happy. Because if a woman is happy, family is happy, society is happy, and the whole community is happy. So that's why I like this 3 which you have and the Rangoli outside, because it's just not for Indian women, it's for all women all over. And I just wanted to share this, that I was in Nairobi in November, not so much for a safari, even though it was nice, my daughter was with me, we did go for a safari, but for the International Conference on Population Development. It was the 25th anniversary. The first ICPD was in Cairo in 25 years ago, and what I was trying to, 2004, one of the challenges is we talk about all this, but there was this young girl in Kenya who committed suicide because she went to school, she was a 15-year-old girl, because her pad, she did not have a pad. She did not have a cloth, so she stained her dress. Her teacher made her stand up in front of the class and shamed her and told her to go out. This child went home and committed suicide. So to me, that is the biggest shame, because it's not what we do, it's how many diamonds we wear or what cars we drive around. I think if a girl's basic human right of not having a pad is not there, we should all be ashamed of ourselves. It doesn't matter if she's a girl from Kenya. It can happen to anybody, anywhere. I mean, some of us don't need pads. I don't, because I'm menopausal. But when I did, it would be an embarrassment if somebody told me, you have stained your dress. And we shouldn't feel shy talking about this, because it's a normal physiological phenomenon. NPP. So I think we all need to ask ourselves, we need to have a rights-based approach when talking to our patients, talking to our students, because they are our torch bearers, because they need to carry the work which we have done, and we hope they will do better than us. Because the biggest satisfaction for anybody is when somebody does it better than you. So coming back to the core principles of human rights, which are now kind of being woven in, you know, like a sari. I think you have Paithani saris here, right? So like if we think of a Paithani sari and we are looking at the core principle of human rights, it's accountability. So it's accountability by all of us, even those who take service from us. It's participation. It's universal, indivisible, and interdependent. It's acceptability, like people need to accept. It's not like you're saying something and saying, ha ha ha, we'll do it. But they need to actually do it. Quality. And the more important thing is people-centric approach. Now we are all looking into, when I work a lot on health policy, I work with a lot of governments, and we are looking at people-centered approach, which needs to be timely. I think Dr. Rohini, both of you, and Dr. Pushpa, you were talking about emergency obstetric care. So in the bundle of care, I would also respectfully like to add equitable, because if it's not equitable, all your efforts go to waste. So that's what we need to focus on. And also, just talking about women physicians, pioneers, this is Elizabeth Blackwell, who's amazing. She was my heroine, and I never thought growing up in India, training in Hyderabad, I would be the first Indian to get the Elizabeth Blackwell Medal, because Elizabeth Blackwell is a woman who was the first physician in the United States. And she ultimately opened her own medical college. Remember, physicians were not accepted in women, physicians were not allowed. And of course, our own Anandi Bai Gopal Rao Joshi, who actually you should be so proud. She was from Maharashtra. I'm not from Maharashtra, but I'm sure I'm as proud of her as an Indian origin person, very much of her. And it is so amazing that when she went there to do her medicine, and the Philadelphia Post wrote, I have the quotes, little Mrs. Joshi. You see the way Americans spell Joshi, it's Joshee. Like Joshua became a female Joshi or something like that. And it's interesting, how many of you know when she died, her ashes were sent back to America, and it's close by to where I live. So I was telling my family, we need to go look at it because I really want to go check it out. And I'll send you a photograph. Yeah, so what I'm saying is, so this woman was also amazing. And again, I love this Google Doodle they had of her in the United States. For Anandbai Joshi's 153rd birthday, Google honored her. Okay, and then you can see the other women physicians, and this is in our Medical Women's International Association. Like Manda is the Vice President of Central Asia and the Secretary General for the MWIA, and it's interesting because this is in the Drexel archives of these women physicians. And also I just want to talk very briefly about Mary Ann Walker's, because these people in the US, they helped for universal suffrage, for rights for women to vote. And Georgia Patton was a black physician who was the first black physician. Now, African Americans were really subjected to a lot of human rights discriminations, and she was a slave, please note, but then she went to Liberia to work. So these are the trailblazers. It doesn't matter what color you are, which country you're born in. We are women and we help our own. You know, it's gender harmony. I tell my husband, I've been married to you for too long, over 30 years. There's something called gender harmony. It's not that you are superior to me or I'm superior to you. So we don't hate our male colleagues. We like them. We are married to men. Some of us have sons. We have brothers. But it's just that we want you to work with us and understand us so that it goes along, medical care goes along harmoniously. Now, Sarah Baker, how many of you remember Typhoid Mary, especially the younger people with all the epidemics? She was the one who really identified Typhoid Mary. And then also, Mary Putnam Jacoby, she was amazing because there was a book brought out by a male, a famous person from Harvard who said, like, basically women are useless when they have their periods, when they have menopause, they can't do anything. So she kind of said no, and she brought to the attention that this is a normal phenomenon. So now coming back to women and politics, because we are all politicians in our own way, because we talk to people, we are diplomats, and if it doesn't work, we throw a tantrum. Why do you throw a tantrum? Because you want it to be for the good of society. It's not for an individual person. Nafi Sadiq was born in India, then moved to Pakistan. She was amazing because the UNFPA and some of you who work in contraception, she has been at the helm of the United Nations Population Fund in promoting a rights-based approach to contraception, because as you are aware, the UNFPA is the largest supplier of contraceptives to the developing world. Now that it's under attack by Trump is another story. I don't want to go into that. Okay, so the other one is Dr. Gro Harlem, who was the Prime Minister of Norway, but she was also the Executive Director of the World Health Organization. So that's another woman who's a physician who's in power. And then this is Michelle Bachelet, who was twice president of Chile, and now she is the head of Human Rights Commission. She headed up the first UN Women, and Dr. Keswani in this picture, my other mentor whom I mentioned, and me are with Dr. Bachelet because we invited her at an AMWA function. And so what is happening present day human rights and equity? The UN Secretary General is having a lot of efforts to increase gender parity, increased enrollments of girls, increased number of tenured professors and deans in medical schools globally. But the question we need to ask ourselves, are there really sufficient mechanisms and laws to promote gender equity, harmony among women doctors globally? The answer is no. There have been efforts, but I think we need to have more efforts. And for this, we all need to work together, to get this going. And I would like to conclude by saying this is so important, that if society will not admit of a woman's free development, society must be remodeled. It's so important. And to round up, the famous anthropologist Margaret Mead said, it takes a small band of dedicated people to make a difference. And I see that band in this room. I think you really have been doing a lot of great work. And, we all have to move it forward. It doesn't matter that this is Amravati, it's Maharashtra, or it's, Telangana, Andhra, the US. We all work together. Thank you so much for this opportunity.